In this lecture, we're going to review a concept referred to as statistical power and how it relates to the null hypothesis, and as well as examining the different factors that affect statistical power. And so statistical power is the probability, and recall that we don't have absolute certainty in statistical testing, but we talk about the probability that a test will lead to the rejection of the null hypothesis. And so when we talk about rejecting the null hypothesis, we're accepting the possibility that two groups will be significantly different. And that establishes the term statistical significance. Statistical power is calculated as 1 minus the type 2 error rate. That is often, usually sits around 20%. As an example, we're going to examine a new drug that's designed to reduce blood cholesterol. So in a study like this, we have two groups. The first group includes patients who were prescribed a generic drug to control high blood cholesterol. And the results after testing had a measurement of 250 for prior to the administration of the drug and a post-treatment of 240. So what we see here, the generic drug was successful in reducing the blood cholesterol levels by 10 units. The second group were similar characteristic patients who had been diagnosed with high blood cholesterol but were prescribed a new drug. And upon the results, we see that the new drug had a 15 unit reduction in blood cholesterol from 245 units down to 230 units. So the question in this study, was the new drug more effective at reducing cholesterol levels? And so when we take a look at these, the two different groups here, one approach is to measure the difference from pre-drug administration to post-drug administration in both groups 1 and group 2, and we find that we have the 10 unit decrease for group 1 and the 15 unit decrease for group 2. Now, there is something potentially missing in this analysis. We do need to consider the variability among the patients in each group. So the 10 unit decrease is the average decrease among all of the patients in group 1. 15 is the average decrease of all the patients in group 2. However, these numbers do not inform us of whether, to the extent that the patients in group 1 may have had a very wide range of responses, and likewise with that in group 2. Nevertheless, we see a rather similar decrease as a result of both drugs, and so we would conclude that the new drug, which was given to group 2, was not more effective than the generic. Therefore, in this case, we do not reject the null hypothesis, we accept the null hypothesis. However, we do this with the knowledge and the acceptance that we could be possibly committing a type 2 error, where the new drug may actually be more effective, but the statistics indicate that the difference between 10 and 15 was not sufficient to get to that, what we will discuss later, as the statistically significant level. But there are different factors that affect statistical power. The first factor is the alpha level that is chosen. So most often, a 5% risk of committing a type 1 error is usually the level of risk that many research studies take. If the consequences of a type 1 error are much more severe, then researchers will often select a 1% level of risk. Using a one-tailed or two-tailed approach will often increase statistical power, and this is a concept that we'll address a little bit later when we get into the actual statistical testing. But the reference to one-tailed versus two-tailed goes to the image of the normal distribution, how we had a tail on one side and a tail on the other side. And so whether we are open to the possibility that the difference could be greater or less, or that the difference could be only in one direction, we'll get to the one versus two-tailed approach. The number of participants or units in the sample does play an important role in statistical power. The greater the sample size, recall in an earlier component of this unit, we showed that as sample size increases, so moving from 20 participants to 30 to 40 to 50, the standard deviation will numerically start to decrease. So what we would see is a tighter distribution. That tighter distribution will decrease the beta and thereby increasing statistical power. Beta being the risk of committing a type 2 error. The smaller sample size, alternatively, has a wider distribution and a larger standard deviation. That will increase the probability of committing a type 2 error and therefore decrease statistical power. Recall that the calculation of the standard error of the mean, which includes the standard deviation in the numerator divided by the square root of the sample size. And so the key thing in examining this equation, that if our denominator value gets larger and larger and larger, so if we move from n of 30 to 40 to 50 to 100, this value gets bigger, this value gets smaller. The third factor affecting statistical power that touches on, that was alluded to in part 2, is the variability. And so the larger the population standard deviation, the wider the distribution of scores, and that will decrease statistical power and the probability of detecting a difference between two groups when it truly exists. Alternatively, a smaller level of variability will generate a tighter distribution of scores, which will increase statistical power. The magnitude of the differences, of course. So if the larger the differences in the average values of the two groups that in the samples to reflect that in the population, will give a study a larger level of statistical power and increase the probability of rejecting the null hypothesis, thereby accepting the alternative that there's a difference when there truly is a difference. And so the magnitude is often determined by what's called a treatment effect that exists within studies, and we'll address that as we go through the various statistical tests. This difference is often referred to as the effect size. So the difference between two groups will have a greater effect size the larger that difference grows. So the last element of this particular lecture is getting to statistical testing. And so statistical testing refers to a series of equations that will help us, that will guide us to making a decision to accept or reject a null hypothesis. And so the next video will get to a couple of questions here. The first question here will ask if the average salary of players that on the Toronto Raptors basketball team is different from all NBA players. So do Toronto Raptors players on average get paid more than all the other athletes in the league? This is the second example. The second question is an example we touched on earlier in the course, is that is muscle protein synthesis, the process in which we make new muscle protein, greater when we double our intake of protein from 20 grams to 40 grams. And throughout the course, we'll address a number of statistical tests. We'll examine what's called the one-sample z-test. This is a set of calculations and equations that will generate a final answer that we will then use to decide if we're going to reject or accept the null hypothesis. The one-sample t-test is very similar to the one-sample z-test, except that the t-test is most often used when we have smaller sample sizes. The two-sample t-test, very similar to the one-sample t-test, except that the two-sample t-test, as the term suggests, examines differences between two different samples. And if we happen to have more than two samples in our research study, the t-test is not sufficiently designed to address that. We use a procedure referred to as ANOVA. So this ends this video related to statistical power.